Hi there. This video is about how we communicate results to patients. If you're using our pathology systems, things get a little bit more complicated in some respects because you're both looking at how clinicians have filed results, but also what our system is picking up as needing to be done. Now, to try and make this a bit simpler, we've developed over the years a protocol for communicating results. And if you see this icon here on the patient's demographics, that means that there's something there to inform the patient about, or at least they've had a recent result. So I've got some real patients, but with details hidden. I'm just going to show you the kinds of things that it brings up and how you might use this to respond to patients who are perhaps phoning up about their results or submitting online requests, that kind of thing. So we click here, and as much as possible, as always, this is trying to be self-explanatory. Appreciate it's not always as clear as we'd like. So here it's saying some results are back but awaiting review. So what that means is the results are in system one, but they're waiting for a clinician to review them. And so until they've been reviewed, we don't want to give the patient information that might then change. So we wouldn't want to say, yep, everything's fine, and then someone reviews that result and says, now we need to see them. So it says here, look, some of your results are awaiting review. We'll get in touch with any if any actions are needed. Or you can send the preset. And if I were to click send preset, I won't do that because it'll bring up patient data, I think, but it basically explains that message to them. Let's discard that one and try the next one. So this one, all results are back and actions are required. So inform the patient. So in italics basically means that's what you might read out to the patient or copy and paste into a message. All your results are back and they need a routine discussion with the clinician. We're going to book a telephone appointment for you now. And so if you were to click book, it would take you to free slot searches and you could pick routine telephone appointment. When you've done these things, it will, at times like this, ask you what you've done. So either it might be that you've booked the appointment or that you've informed the patient. When you pick those options, it will add various codes and notes in the background that help the system to know, right, we don't now need to contact this patient or things are in hand. Pick another one. So this is where it starts to get a bit more complex. So results are back and some actions from results. Actions might be in progress or awaiting further review. So this is generally where there's a kind of mix of things going on. And so we click view results and it takes us to this template, our pathology overview. So at the top here, we've got a kind of summary of what's going on. So first of all results are back from the last sample. So there's nothing else outstanding. There's a message that we auto sent when the record is saved. So that means that there's some kind of message. It might be about a normal result or something that needs action. And when you save the record, something will be going in the background. We've developed a lot of these because we think it's best for patients to find out quickly about their results. And sometimes they're just saying everything's satisfactory with, say, your kidney result or your cholesterol. Other times there's a bit more to it. We can also see, though, that there is a questionnaire that needs completing. If you see these 3 stars, it always means you can action them. In this case, it will just take you to our questionnaire view, template, and you can see what questionnaire specifically we want to answer. For more detailed outcomes, you've got it by different results. Now, blood pressure is not a blood test, obviously, but it does relate to kind of pathology, and it's this part of our module and our system. So they've had a raised clinic BP and they need a home blood pressure. HbA1c, so here it's putting in brackets what that means. So it's a diabetes screening or monitoring test. It's satisfactory and there's no actions required. Here we're seeing more of the specific questionnaire to complete. And again, it's saying, so it's cholesterol blood test and a statin change. Now, if the patient's on the phone and you can see this, the best thing to do is to complete it with them. So if we right click and action and bring it over here, you can read it out. So your recent results show your statin has not reduced your cholesterol as much as we'd like. Are you taking your statin regularly? Yes. And then if you, depending upon the answers, it will give the next steps. So if they say no, for example, we recommend trying to be more consistent. If they want to talk to a pharmacist about it, This is written mainly in mind of people doing this on their phones, but it says, we'll get in touch to arrange a review. So you would save final version and book a review with a pharmacist. Let's say they put yes, though. Again, there's more detail to read. There's another question. A lot of the time, patients will just say, yep, please change my statin. And in which case, that will go to a pharmacist for them to review. All you would need to do in that instance is save the final version, and that's it done. So where you can see these kind of 3 stars, look for that. That means there's an action to do. Right-click an action, and it will let you do that. And that will help sort of move the system along. We are trying to make this as clear as we can, but I appreciate sometimes it's a bit confusing. This is probably an example where it's a bit confusing because there's no kind of essential action from the vitamin D. It's a normal result, but they've got vitamin D on repeat, which perhaps could be stopped. But that's not a kind of, it's not like an appointment's needed for that. That's more of a note to pharmacists to consider it. That's probably an example there where we do need to think about making that wording a bit clearer. But again, the key outcomes where there's actions needed particularly are at the top here. And then the more detailed things that relate to particular results that our systems pick up is this section. And then down here, you've got all of their recent results. So for example, full blood count is not something that our systems do anything with. If that had been filed by a GP saying, speak to doctor, that would be appearing up here as an action. But if you want more detail, you can look down here. If we were to look at, say, the lipid levels, we can see here filed as unknown other, and it explains that what our system will do for that. And you can see that it's Emma who's filed that. If we look at full blood count, Emma's done it as well, which means it must have been a satisfactory normal one. She wouldn't file if it was abnormal. So you can see more detail there if you need, but the majority of the time, the information you need should be here. No, I haven't informed the patient, and let me make sure I discard that and don't save that questionnaire. And then last one here, all the results are back, repeat tests are required, book now. So again, there's something you might want to read out, and again, you can click the option book now, and it will take you to the free slot search, or actually, sorry, no, it's actually gone into our monitoring prompt, and you can see here why actually, because although they need monitoring tests now, this patient's actually due their annual review soon. So rather than just do the blood test and then, a few weeks, a month or so later being invited for their annual review, it's saying do the whole lot. So we click that and it will then work out and tell us what appointments the patient needs. So a respiratory review that includes a blood test. For your practice, that might be 2 separate appointments. The bloods might be done elsewhere. But the point is we're trying to do the review and get everything done at once, not sort of separating it all out. Appreciate that if you've got the patient on the phone, it's not always easy to take your time and go through these steps. No, I haven't booked that appointment. But as much as possible, that link there, that protocol is designed to try and explain what's going on, help you know what to do next and what to tell the patient. If there is particular wording you think we can improve or ideas, as ever, do let us know. And hope this video helps. There are lots of scenarios that might crop up. Those are some of the most common ones. Thanks.